Okay, so now we're going to start up. I'm interrupting you for real. Hopefully the very engaging thought you were just in the middle of you can pick back up on a break or in a later discussion. Great. So now we're going to officially kick things off for the day. First and foremost, I just want to welcome everyone to this Institute of Medicine meeting here in our National Academy of Sciences building. And really thank you all for coming. It's really exciting to us that there were so many of you who were really excited about this event. And we know that means that you're really crowded and really intimate and really cozy with each other for the day. So thanks for putting up with that as well. And therefore allowing us to have more people in the room. So my name is Bridget Kelly, and I work here at the Institute of Medicine. I'm the director of our Collaborative for Global Chronic Disease Prevention and Control. And that's the group that is organizing the meeting today with a couple of people who've been helping us I'll say more about later. Our collaborative is actually a small exploratory arm of the IOM's Forum on Public-Private Partnerships for Global Health and Safety. The director of that forum is here today, Kimberly Scott. So if you have any questions about that, feel free to catch her and hear more about that. Our collaborative within that forum is focused on exploring health in ways that span disciplines and settings and sectors, and to conceiving of partnerships for health in new ways, and for fostering progress in how evidence is generated and used. So you can see how that ties into the meeting. You have the agenda and a rationale document for this meeting in your folder, so you can read that in more detail. But to just say a few words about that to set the tone for the day, we've kind of noticed over time that a lot of people are really starting to think about and are really chomping at the bit to kind of push the boundaries of how we think about evaluation. And especially to figure out how we can use evaluation to help push change in communities. And so this meeting is really about exploring those topics. This meeting grew out of the confluence of three things. One is that our collaborative, recognizing that global chronic disease prevention and control is only going to happen if, in large part, we create health at the local level all over the world. So that's the global community connection. And if that's going to be a key approach, we need ways of designing evaluation and approaching evaluation that really fit that purpose and that can really meet those aims. So that was our interest in this meeting. Pritpal, who you'll hear more from in a little bit, is a person who's committed to doing something about the staggering need to make health about more than healthcare, and has a Creating Health incubation group to try to help make it the norm to do health creation that's really aligned with what people in communities value. And recognizing that to build that, you need ways of measuring it and ways of knowing whether or not it's working. So that was the interest that brought him to the table. And then Rick, who you'll also hear more from later, is one of the leaders of the Way to Wellville Challenge, in which 5 communities are having a friendly competition to implement initiatives in their communities that will contribute to health and other objectives over the next 5 years. So they are in the process of coming up with a framework for how to evaluate that challenge within the cities and across the cities. So that was what brought them here. And one of those towns, Spartanburg, is going to be kind of our focus community for the day. So thanks very much to Rick and Pritpal for all of your great help and inspiring conversations and input into what we're doing today. So we've also had some really nice input from the IOM's Roundtable on Population Health Improvement, which has some crossover interests, and I just wanted to highlight that they have a report coming out soon from a workshop they did recently on the role and potential of communities in population-level health improvement. That's coming out on September 4th, and it'll be on the IOM website, so that might be something that all of you will be interested in seeing. So today's meeting is in no way a comprehensive look at community health or at evaluation, so we don't have any illusions that we're going to achieve that in one day. We know we can't figure out the deepest concerns of a community like Spartanburg by just talking with them for a few hours. And we know that designing an evaluation takes a lot of careful preparation and careful consideration and thinking through techniques and methods that take far longer than the couple of hours that we will spend on that today. probably we could spend the whole day just figuring out what we mean by evaluation and what we mean by community. So that in and of itself would be a challenge. So instead, what we're really trying to do today is just have a lot of people in the room who can bring different aspects and perspectives and experience to these issues, and to just get a glimpse, with the help of all the collective expertise that we have in the room, into some specific approaches to evaluating community health initiatives. So we'd like to think that by doing that, we'll spark some ideas, and that will also be building a little bit of a community of people who will all now know each other and be able to support each other as you do this going forward. As part of this glimpse, as you know, we've chosen to kind of have one community here that we're really focusing on. That's really just to give a concrete example throughout the day to frame our thinking. We wanted to do that so we could really think about one place instead of thinking about just general community characteristics that are, vague and just kind of theoretical. So even though we're focusing on Spartanburg, though, we really recognize that everyone in this room is from a community, is in a community. So when we talk about community values and needs, we hope that you'll all bring that perspective no matter what your day job is. So we don't know where this will lead, but hopefully it will be catalytic and fun, and a lot of elbow bumping. In your folders is a next steps card. We're going to mention that a few times throughout the day. We would really love for you to fill that out. It has, not right now, although you might have things to put on it right now, you can fill it out iteratively. It just has some ideas on additional resources. We're compiling the resources people sent to us in advance with additional things people say today, and we'll send that back out electronically, and also some ideas for what we might do next. We also have a graphic recorder. Joe's just going to take a minute to say something about what he's doing.
What I'm doing is capturing conversation. I'm going to try to capture the conversation that all of you will have in real time, and try to take notes and draw little pictures, and hopefully we'll have a record of what
Thanks, Joe. You do have Post-it notes on your table. We are a very Post-it note friendly collaborative. We keep 3M in business. So if you have an idea during the day for Joe, write it on a Post-it note, take it over to him. If he's really busy and full of Post-it notes, we'll put up some other pieces of paper around the room that you can put your Post-it note on and jot your ideas down. Use that next steps card. Many modalities for sharing your ideas with us. So we're going to dive in with the morning sessions. I did. Yes. Leah's reminding me to tell you that we're compiling the resource list, and we're going to send it to you. I'm going to do super short introductions. That's going to be a theme throughout the day, maybe the least formal introductions ever in the history of an IOM meeting. You have all of that in your packets, people's bios. Those of the people who are speaking and who are on panels have bios in there, but also those of you who are here participating who sent us little introductions, so browse that as you have time. So this morning, first, Pripal's going to come and just set the stage for us with a few words on his perspective about what has driven him to see evaluation as a really key part of this movement to creating health in communities. I already mentioned the incubation group that he spearheads among his other hats. After that, Fareed and Ashley, who are out in the open space, are going to have us move around, get out there, and start kicking off our community conversations, which is the theme for the morning. They work at the Arena Stage, which is a DC theater company, in the Education and Community Engagement Department. So they're going to help facilitate a conversation amongst us, both physical and verbal and written. So that should be fun. And then Ivan will moderate a panel of representatives from Spartanburg, South Carolina, who are going to talk a little bit about what's important to them and what kinds of things they're interested in changing their community. So hopefully some of the things that you've already talked about at breakfast will come back there. Ivan is the president of Motivational Educational Entertainment Productions, where he works to understand the challenges of daily urban living and to turn those into media productions and socially driven, community-driven change. So the rest of the day will unfold with some lunch and then a little bit of a more formal conversation about evaluation with a couple of people who are really going to have some great insights to share. And then we're going to do some breakouts to brainstorm some evaluation approaches. So we'll get started. I will just say a word of thanks to two people, Laura McKenzie, who has really been the glue holding together all of the logistical aspects of this meeting, which we really appreciate, and then Lee Carroll, who is my partner in crime in the collaborative and has really been the driving force between making this meeting happen. So my thanks to them. And thanks to all of you for being here and in anticipation for your robust participation throughout the day. So over to you.